Hi, and welcome to KXAN Plus. I'm your host, Esmeralda Zamora, and this is our Simple Health segment. With me to talk all things health is our health expert, Jose Torres. Jose, how are you doing today?
I'm doing great, Esme. How are you?
I'm doing great. It's been a long day, so I'm trying to bring myself together so that we can have a fun conversation, right?
Maybe you need a good run.
I do. I need a walk outside. The weather is great. It's been great for quite a while. It's not super cold anymore.
Yeah.
So I like to go walking when I get home, and I'm excited to do that today.
It'll re-energize you.
Yes, I need that energy. Well, Jose, before we get into our topic for today, please remind me and our viewers what Simple Health is and why we cover Simple Health here at KXAN.
Well, there's so many untold medical stories here in Central Texas, whether it's research, new treatments. There's so many here, stories, like I said, that go untold. And so our goal here is to empower you with information that could maybe bring you some hope if you or a loved one is recently diagnosed with cancer or maybe diabetes. We have stories that can help maybe give you some hope or maybe answer some of the questions that you have. So we're excited to do that, and it's a joy reporting on these things.
And specifically today, we're going to be having a fun conversation about medical research and some new initiatives that can help with survival rates. Before I explain all of it, give us a rundown of what our topic is today.
Well, let me start with the good news, and that is that cancer survival rates are rising. That's amazing. And there's so, like I said, there's so many things going on here in Central Texas that is impacting survival rates. And one of those is that there's a new resource here for cancer researchers developed by a 21-year-old UT student. And our Eric Hendrickson, he's a regular at KXAN Plus with his science reporting. Well, he talked to this 21-year-old to learn more about this research and how it could develop new policy to help fight cancer. Take a look.
This is the country analysis feature. You can select a country here. I've selected Egypt.
A new tool for policymakers around the world.
An area of concern, for example, is health spending.
The tool Global Health Predictor Insights, developed by University of Texas Austin undergrad Milit Patel, uses AI to explore what a country can do to reduce cancer deaths.
We gathered data from the United Nations, the Global Bank, and different types of databases and combined it into one central database.
The tool uses 10 different factors to determine its outcomes, from the country's GDP to the numbers of doctors, nurses, and midwives it has.
There is a heat map which shows it for each country stratified by each of the factors.
The AI behind the tool takes these 10 factors associated with cancer, looks at how they interact, and provides policy suggestions countries can use to reduce cancer deaths.
This suggests that policies focusing on the efficiency and targeted allocations of healthcare funds rather than overall budget might be more effective than improving outcomes.
Using AI in medical research has grown rapidly, even among scientists with the American Cancer Society looking at mountains of data.
For us, it's really time efficiency.
Alita Fuentes Bowles says they haven't used this new tool yet, but their own research found access to health services is a leading factor in survival.
The two biggest barriers to cancer care is transportation and lodging.
While still very new, Millet's tool has potential to reshape the way the world faces a devastating disease. In Austin, Eric Hendrickson, KXAN News.
Jose, tell me a little bit more about that data that is being gathered that we just heard about.
Yeah, so Eric found out that this research uses data from 185 countries to make its predictions. And some of those factors included in this analysis, they look into whether radiation therapy like chemotherapy, universal health coverage, and whether a nation has access to pathology labs. So Eric wrote up this awesome web story. He goes way into detail about this this resource that this UT student developed. And look for it, University of Texas Student Developed tool to identify what drives cancer survival. That is the headline for that story. And again, he goes deeper and into that research. And then you'll hear more about the UT student there, 21 years old and already making a difference in the fight against cancer.
I know, that's amazing. Getting a head start, still in school and already making a difference. That's props to him because that I bet it's very hard. Jose, the advancement of this technology has also helped reduce the number of cancer deaths. What have you seen regarding that, and how did it reduce this?
Well, there's more good news here that I kind of touched on in the beginning, that most cancers are no longer considered a death sentence. And so new survival rates show that 7 in 10 people now survive 5 years or longer after a diagnosis. And all of this research is according to the American Cancer Society and their report released in January. And there's a lot of excitement about this. The lead author of the report said, decades of research helped create new ways to treat the disease more effectively. And I love this quote that we have here for you. The lead author of the report said, turning many cancers from a death sentence into a chronic disease. So that is amazing news. And here in Austin, a breast surgical oncologist says this new data has been a real sign of hope for patients and her patients and everyone else who is battling cancer. Listen to her.
The earlier we can catch cancers, the more options we have and the higher our survival rate is going to be. Right when I found out about these statistics, I was able to tell one of my postoperative patients this survival rate, and she was just so excited and almost started crying because of how wonderful that is.
Jose, did the researchers say what is helping with these survival rates?
Yeah, so there's a lot of factors that are helping with seeing more people beat cancer. Among those include people are not smoking as much. Early detection is also helping with improvements. And the other thing, though, that this report did note was that while people are living longer now, common cancers like breast cancer and colon cancer rates, those are continuing to rise. So there's still, some work to do, but researchers are doing an amazing job right now.
Doing what they can, that's right. You talked about colon cancer, and with colon cancer pre-screenings, you would get a colonoscopy. When should people get a colonoscopy? Around what age is the appropriate time to start?
So the experts have actually reduced that number, their guidance. It used to be in over 45, but now they're asking people 45 years old to get one. And the earlier, the better, right? And the reason behind that is because the American Cancer Society, they say that colorectal cancer in adults between ages of 29 and 39, they've been rising over the last decades. And so younger people are getting diagnosed with this type of cancer. It used to be adults that were 55 and older. So they're worried about this, and they're asking people 45 to get colon cancer tested. And it's pretty easy. I did mine a couple of years ago, the prep work. I know people don't like to hear about that, but
it's part of it, right?
It's part of it, but if you follow the instructions, it takes 2 hours, and then you just fast, and you go get your procedure, and it's done within 30 minutes. But again, so most people should get their first colonoscopy at age 45. That's according to researchers. And
you can find that on American Cancer Society. They have recommendations on here, right?
Yeah. What you have pulled up there is perfect. If doctors don't find any polyps during the initial colonoscopy, then the next one would be in 10 years. For higher risk people, they should get with their doctor, tell them about their family history, whether if somebody in their family had colon cancer before, or if they have that genetic gene that is hereditary.
Yeah.
They should also talk to their doctor about getting screening at a younger age.
Yeah.
25, 30. That's important because early detection is key. And I actually just found out about genetic testing. mom was recently diagnosed with stomach cancer, and so now her oncologist is noticing something in her blood work or in one of the biopsies. I mean, and they noticed there's a gene there that could potentially be hereditary. So we're going to go through that process and see what that is like. And again, that's key to know for early detection, because the earlier you find it, the better your chances are of survival.
Yeah, thanks for sharing that, Jose. I know that there's a lot of individuals who are curious about hereditary cancer and how they can get tested for that, or where they can get screened to make sure if they have it or if they don't. So excited to hear about your process, but sorry about the situation. And thanks for sharing it here with everyone who is also curious about this too. What about breast cancer? Is it the same for breast cancer? Does the detection start earlier? What do they recommend?
The earlier the better, according to the American Cancer Society. They say that women ages 40 to 44 should have the choice to start annual breast cancer screening with mammograms if they wish to do so. Women ages 45 to 54 should get mammograms every year. And women 55 and older should switch to mammograms every 2 years or continue yearly screening. And again, this all depends on the trend and patterns and results that you get, and your relationship with your doctor. Just continue communicating with your doctor. So Ava Bangord did an amazing story again, just like Eric did. And she put a link to this, all to the guidelines I just mentioned. And in her web story, you'll discover about these cancer survival rates in this latest report. She also took a deeper dive into what those results show. And she looked at how nationwide rates compare to Texas. And again, you can find helpful resources there and screening guidelines. She has a link to that on her web story. And hopefully it'll be useful information that maybe you or a loved one can use, or just to be informed.
Yeah, or even learn something new, see how the numbers are changing throughout the years. And it's always nice to have someone take a look at these statistics for us, because it's very in-depth and lots of information is put into these articles. So when we can break it down for everyone, it helps everyone, right? It makes you understand and see where these numbers are coming from. And even those links that you mentioned in Ava's story are very helpful.
Yeah, sometimes medical information, research information can be too overwhelming.
Yeah.
They use a lot of vocabulary that we are not used to. And so they simplify it for us, the American Cancer Society does. And then we simplify it even more for you to read over it and digest it, and again, hopefully get empowered with all that information, and hopefully give you some ease and hope if you, again, or your loved one is suffering from cancer. And again, I think the other thing is that listen to your body. We've had guests here with who survived cancer who thought, a pain in their back was just a pain. They thought maybe they stretched wrong or
Pulled something.
Yeah, they pulled a muscle, but it ended up being cancer. So listen to your body, and if those symptoms last forever, or not forever, but for a long period of time, it's time to go back to your doctor. In the case of my mom, she felt some acid reflux and something strange in her stomach. And initially, her primary doctor thought it was just this gastritis.
Common symptoms, right?
Yeah, a condition that older people face as they get older. But it continued, and the discomfort continued. And so then we went to an oncologist to get some testing done. And so, the key here is to listen to your body.
Yes.
And communicate with your physicians, your primary care physician, and then we'll go from there. They'll go from there to see what else needs to be done.
Yeah, and we hear a lot of times that early detection can save lives, but it's hard for your physicians to detect things early within your body when you don't go and see them regularly. So like you mentioned, making sure that you are observing your body, listening to your body, and understanding what is off and what isn't off before you jump to conclusions is probably the best idea, right?
Right. And sometimes, access to a primary care physician can be hard, whether that's transportation or maybe funding, health coverage. There are some resources out there with the state of Texas or maybe even federal assistance. So it's important to also look into those and lean into your community. Even if you have those resources, it's also great to lean into your friends, your neighbors, your
Yes.
family, because community keeps the heart beating.
Yes, and we just had a winter storm, so I hope everyone spoke to their neighbors and got in contact with them, or at least got their contact information for any emergency that happens, not just a winter storm, but anything that happens around your home or in your life, right?
Yes.
Well, Jose, thank you so much for joining me. Before we wrap things up, I want to ask you, what are 4 everyday tips that you could give to a viewer to help stay on top of your health and make sure that your the rest of your 2026 goes on as a healthy start?
Okay, you put me on the spot. Okay. Well,
What do you do every day?
well, let's see. Let's see. Your main goal is to lose weight. Let's just say that that's your main goal. Well, ask yourself, why do you want to lose weight? It's more than just a physical thing, right? There's probably, like in my case, I want to avoid getting cancer. I want to avoid getting another chronic disease. I'm already diabetic, so I want to avoid that. So that is my deeper, as I peel the layers behind that question as
Your
to
why.
I
Yeah.
want to lose weight. Just dig deep into that question, and you'll find your answer. And then keep that answer fresh in your mind. And it's baby steps. You can't reach your goal overnight. And so baby steps. A baby step is a win. And this sounds cliche, but all of those baby steps are going to lead to a major milestone if you just keep at it. Third is kind of aligns with that is consistency. And again, that will help you reach that goal. And you might get discouraged because you might not see the goals right away. But just be consistent and also lean into your friends. They might be going through something similar, or maybe they can guide you with something that worked for them.
Great recommendations, Jose. So inspiring. And hopefully that pushes someone to continue with their New Year's resolution. I know that was our last conversation that we had. And you can always revisit that on KXAN.com or KXAN Plus if you want to recap on what we talked about and some helpful insights, just like the ones Jose just shared regarding your New Year's resolution. Jose, thank you so much, and we'll see you next week.
Thank you.